Hello, students. Welcome to chapter 65, part 3. Remember, this is your interactive blueprint. You can listen to this video, to this recording. You can fast forward, you can stop, rewind, you can check the hints. That's good to know for the quizzes, exams. You can get everything you missed in class in these videos. Okay, so let's continue with the chapter 65 part 3. um, we were talking about the use of tamoxifen, right? That's the last part of chapter 65, part 2. And we were talking about that this medication can cause risk for blood clots and endometrial cancer, right? So now we are gonna start with the patient-centered care, cultural, spiritual considerations. Some cultures do not allow men to be part of a woman's care or allow only women to care for women. Other cultures are male predominant and all decisions about female care are made by the significant man in her life, who may be a father, spouse, or oldest son. It is important for the health provider and nurse to provide cultural sensitive care and to respect the belief and practices of the patient. That's very important. Ask specific information about personal and family histories of breast cancer. Ask about the woman's gynecologic and obstetric, if any, history, including age of menarche, age of menopause, symptoms of menopause, age at first child, or nulliparity, having no children, number of children and pregnancies during miscarriage or terminations. And remember that the woman that has their first period on an early age and they are having their menopause on a very late age, they have the highest risk for developing cancer because they are exposed to estrogen. So if you started your menstruation at 11 and then you're having your menopause at 55, 56, all those years you have been exposed to estrogen. So that those are the women with the higher risk for developing either ovarian or breast cancer. Recognize that increased risk factors include prolonged hormonal stimulation, early menses and late menopause, whatever I explained right now, use of contraceptives, okay, and birth of the first child after 30 years of age. And remember also the woman with high education and high socioeconomic standard of living, they are in the higher risk for having breast cancer because they decide to become a mother on their 40s, right? So this is in reference to birth of the first child after 30 years of age. A history of the breast mass or lump can reveal the course of the disease and information related to health care seeking practice and health promotion behaviors. Review with the patient with procedure has been performed to diagnose the problem and if they have noticed any other changes in their body within the past year. Assess the use of alcohol intake. We know that alcohol, certain drugs, obesity are some of the risk factors for developing cancer of any type, right? Of any type. Because, well, we're talking right now about breast cancer, but remember that in general, this semester we have discovered obesity is related to everything, right? So let's go back. This is a factor that may increase breast cancer risk. Perform an in-depth medication review, including prescribed and over-the-counter drugs that are used. Specifically, ask about hormonal supplements such as estrogen and natural or herbal substances that stimulate hormones and birth control use. Estrogen can be taken orally, intravaginally, or via a transdermal patch. So herb supplements that that stimulate hormones are marjoram, ashwagandha, which is a Ayurvedic therapy, is very common in India. Nigeria seeds or cumin seeds, black cohosh root, chesterberry. Best way to balance hormones is to eat a healthy diet, drink green tea, get regular exercise, manage your stress activities with yoga, listening to music, or taking a walk in nature might relieve stress and keep these hormones in balance. Get enough sleep, avoid endocrine disruptors, compounds in the environment such as tobacco, smoke, pesticides, herbicides, plastics, flame, and fragrances in lotions and cleaning supplies that may cause hormonal imbalances. Breathing exercises. I have submitted one which is good that I show you, is also in the supplemental file that I always give to you guys. So let's review this one because I spoke to you about these breathing exercises to reduce stress and anxiety.
In this guide, we're going to talk you through an alternate nostril breathing exercise. It's a great way to calm the nervous system and an effective stress reliever that everyone can practice at any point throughout the day. To start the exercise, come into a comfortable sitting position. Ensure that your spine is long and rest the backs of your hands on your knees, with your palms facing up towards the ceiling. Bring your right hand up, make sure your index and middle finger are touching, and then bend those fingers in towards the palm. Place your thumb against your right nostril and inhale through the left nostril. Then, move your hand to place your ring finger and little finger against the left nostril as you release the thumb and exhale out through the right nostril. Inhale through the right and then swap over and exhale out through the left. This is the alternate nostril breathing exercise. Inhale through the left, swap the finger over, release the thumb and exhale out through the right. Then inhale through the right, swap over and exhale out through the left. Continue to repeat this exercise for about 10 to 20 breaths or until you can feel your body is relaxed. Keep the breathing steady and consistent. So, there you have a simple demonstration of an alternate nostril breathing exercise.
Thank you so much. So you have that alternate breathing nostril breathing exercise. So in all these diseases, stress is a big factor. So through the entire semester, I spoke to you about deodorant to minimize aluminum. I spoke about the oil pulling, so you can remove the excessive mucus in your ears, in your throat, and your gastrointestinal system. And also the mucus is going to increase the controlling of your diabetes and other diseases, right? It's gonna improve the presence of the microbiota in your gastrointestinal. Now we are talking about the breathing exercises related to improving stress. So those are practices that you can start. At home or maybe in your office. You just need to have a comfortable sitting position and start practicing these breathing exercises. Okay. Remember, these are in the supplemental file that I provided for this week. Best practice for patient safety and quality care: assessing a breast mass, assess whether the mass is fixed or movable, to differentiate between benign or malignant cancer. Note any skin changes around the mass, such as dimpling of the skin, increased vascularity, nipple retraction, nipple inversion, skin ulceration. Assess the adjacent lymph nodes, both axillary and supravicular nodes. Okay. Physical assessment, clinical signs and symptoms, location using the face of the clock method, shape, size, consistency, and whether the mass is mobile or fixed to the surrounding tissue. I explained also before about how to identify the location using the clock, right? Clockwise. Note any skin change such as pale orange, redness, and warm. So, redness and warmth, nipple retraction or ulceration, laboratory assessment, laboratory tests, including pathologic study of the lymph nodes, help detect possible. This is good to detect metastasis. Elevated liver enzyme levels indicate possible liver metastasis, and increased serum calcium and alkaline phosphatase levels also suggest bone metastasis. Because remember your BBLL, right? Breast cancer metastasized to your BBLL, your brain, your bone, your liver, your lymph nodes, right? Okay. Mammography is a sensitive screening tool for breast cancer. Digital breast tomosynthesis is technology that is similar to mammography but uses three-dimensional images. This is the 3D mammogram. Ultrasonography of the breast is an additional diagnostic tool to clarify findings in your mammogram. MRI is used for screening high-risk women and better examination of suspicious area found on a mammogram. If the patient has an invasive breast cancer, other imaging tests may be done to rule out metastases. Here you have breast tomosynthesis and the different images that are obtained in this 3D type of mammogram. Other diagnosis assessment is the breast biopsy, pathology examination of the breast. Cancer cells that contain estrogen receptors ER positive or progesterone receptors PR positive have a better prognosis and usually respond to hormonal therapy. If the type of breast cancer is HER2 positive or one in which the new gene is overexpressed, it may be treated successfully with trastuzumab, which is a HER2 positive breast cancer specific targeted therapy. You see, in these cases, these receptors make the treatment successful in comparison with the triple negative receptor, right? Cancer receptor that does not have estrogen receptor, neither progesterone, neither HER2 receptor. Genomic tests such as oncotype diagnosis and MammaPrint have been developed to help predict clinical outcomes by analyzing genes in breast cancer tissue. Some healthcare providers use this information in addition to the pathologic analysis for guiding treatment decisions. These multi-genes tests have been shown to be accurate predictors of patient prognosis and response to therapy in breast cancer. Important tools: the Oncotype DX and MammaPrint to decide on treatments and analyze prognosis. What is prognosis? Is the outcome that the provider is expecting after the treatment, right? So, estrogen receptor positive cancer has a better prognosis than the triple negative, okay? Decreasing the risk for metastasis. The emphasis of breast cancer treatment is on preventing or stopping the spread of tumor cells that lead to distant metastasis. Treatment is tailored specifically to each patient, taking into account other health problems and the patient's ability to tolerate a particular therapy. Non-surgical management, complementary and integrative. Physical and emotional symptoms associated with breast cancer may be eased with the use of complementary and integrative therapy. Prayer is also widely used. And this is the most effective prayer, especially when it's in group, right? Other types of therapy include guided imagery and massage. The most frequently used strategies are biologically based therapies such as vitamins, special cancer diets, and herbal therapy. Teach the patient that all ingested complementary agents potentially risk interaction with conventional drugs. Acupuncture, chiropractic therapy, massage, shiatsu. I found very helpful the practice of these integrative treatments, um, many of them at one time. So there are patients that are eating their sauerkraut, they are doing their celery juice, also they are using the Reiki sessions all together. So they go, they do the chemotherapy, they have a special diet, they go for Reiki. They do 6 or 7 different therapies between drugs, chemotherapy, and other integrative therapies. All together works wonders. Okay, it's not only one therapy. For patients with breast cancer at a stage for which surgery is the main treatment, follow up with adjuvant in addition to surgery, radiation, chemotherapy, hormone therapy, or targeted therapy is commonly prescribed. For those who cannot have surgery or whose cancer is too advanced, this therapy may be used to promote comfort, palliation, and of life care is discussed. Surgical management of early stage breast cancer is surgery. A large tumor is sometimes treated with chemotherapy called neoadjuvant therapy to shrink the tumor before it is surgically removed. An advantage of this therapy is that cancer can be removed by lumpectomy rather than mastectomy. This may provide less invasive surgery for a very cosmetic outcome of the patient. And lumpectomy is the removal of the lump, just the tumor, the mass, okay? And mastectomy is the removal of the entire breast. Common complementary and integrative therapies used by patients with breast cancer. For pain, they use acupuncture, chiropractic, hypnosis, massage, music, Reiki, shiatsu. For nausea and vomiting, they use the same but also aromatherapy, which I heard is very good, is very effective. Some of the clinics that are giving IV chemotherapy in the ambulatory setting, they are having their essential oil diffuser. So aromatherapy is well known. Ginger, progressive muscle relaxation, meditation, yoga, flaxseed oil, cohosh, as I mentioned before. Use caution with all herbal and ingested supplements. There is no substantial data to support one treatment over others. Remember that in order to create evidence-based practice, you need to have a research study in place. Sometimes grants are not given for this type of integrative therapies, right? So there is no grants for studying the effects of shiatsu in cancer patients, let's say. So there's not enough studies. More grants are given for medications and chemotherapy and radiation practices. So Still, we have to consider that may be useful, okay? Remember, when the river sounds is because it carries stones, okay? Aromatherapy, in case of muscle tension, anxiety, stress, is treated with journaling. This is one of the greatest therapy, journaling. Great therapy. Music therapy is excellent. Prayer, support groups, especially when those support groups are united for prayer. Aromat, yoga, journaling, progressive. Okay, very good. Axillary lymph nodes are analyzed for the presence of cancer and staging purposes. Axillary lymph nodes dissection is usually done when there are clinical positive nodes. Sentinel lymph nodes biopsy is a much less invasive approach and is recommended by guidelines for analyzing lymph nodes in early stage breast cancers with low to moderate risk for lymph node involvement. In this method, the sentinel lymph node is identified during breast surgery by injecting the breast with radioisotope or a dye that travels via lymphatic pathways to the sentinel lymph node. The nodes that take up the dye are removed and examined for the presence of cancer cells. It is believed that if cancer cells have traveled through the lymph channels, the cells will lodge in the sentinel nodes. Preoperative care of the patient facing surgery for breast cancer focuses on psychological preparation and preoperative teaching. Provide postoperative information, including the need for drainage tube, the location of the incision, mobility restrictions, the length of the hospital, if any, general preoperative and postoperative information needed by a surgical patient. Operative procedures during breast conserving surgery, also known as lumpectomy or partial mastectomy. The surgeon removes part of the breast that contains cancer or some normal tissue around it. Typically, indications for a mastectomy, we're talking about mastectomy, include multicentric disease. Tumor is present in different quadrants of the breast. Inability to have radiation therapy, presence of large tumor in a small breast, genetic testing results, and patient preference. So here you can see total simple mastectomy, modified radical mastectomy. These are surgical treatment for breast cancer. Assess the patient's position to ensure that the drainage tube or collection device is not pulled or kinked. The patient should have the head of the bed elevated at least 30 degrees with the affected arm elevated on a pillow while awake. Keeping the affected arm elevated promotes lymphatic fluid return after removal of lymph nodes and channels. And that's good to know. It's coming in the exam. This is post post procedure, right? Post surgery, and this is nursing care relating to that. Ambulation and a regular diet are resumed by a day after surgery. While the patient is walking, the arm on the affected side may need to be supported at first. Gradually, the arm should be allowed to hang straight by the side. Encourage the patient to use good posture to prevent mobility issues. Exercises include squeezing the affected arm hand around a soft, round object, a ball or roll washcloth, and flexion extension of the elbow. And that's good to know too. That's another good exercise. Breast reconstruction is considered after, usually after total mastectomy, no? Patient and family education, preparing for self-management, post-mastectomy exercises, and you have the whole list here. Hand wall climbing, rope turning, side bends, shoulder blade squeeze. Here's another NCLEX examination challenge. I would pay attention to these questions if I were you. Examples of breast reconstruction procedures. You have the implantation, description, how is it done, right? This is for you good to know. I'm not testing you on this unless you will be looking for a surgical certification. If you are going to work with a surgeon, probably. But this is general information on how the test is going to be performed. Most important is nursing intervention, pre and post procedure. Pre and post procedure, okay? You need to assess for signs of infection, special considerations depending on the breast that it was treated. If it's the right, if it's the left, you don't take blood pressure on that left arm. If it was the left breast that went under surgery. Breast expanders are the most common methods of breast reconstruction used in the United States. A tissue expander is a balloon-like device with a resealable metal port that is placed under the pectoralis muscles. A small amount of normal saline is injected intraoperatively into the expander to partially inflate it. The patient then receives additional weekly saline injections for about 6 to 8 weeks until the expander is fully inflated. When full expansion is achieved, the tissue expander is then exchanged for a permanent implant during surgery in an ambulatory care center. The permanent implant is filled with either saline or silicone. Autologous reconstruction using the patient own skin, fat, and muscle is advantageous because the donor side tissue is similar in consistency to that of the natural breast. Therefore, the results more closely resemble a real breast compared with implant reconstruction. Reconstruction of the nipple areola complex is the last stage in the reconstruction of the breast. Patient safety and quality care related to postoperative care of the patient after breast reconstruction. You're welcome to read this. Remind the patient to avoid sleeping in the prone position. That's extremely important. Also, to monitor and measure drainage in collection devices such as for the Jack Pratt's drains. Those are little bottles, I would say like 6 or 7 centimeters long by 3 to 4 centimeters wide, and you have to notate the amount of millimeters you are collecting fluids after surgery. Remind the patient to refrain from driving until advised by the surgeon, to minimize pressure on the breast during sexual activity. Basically this. You're welcome to read the entire list. Women who have a mastectomy and breast reconstruction in one breast should have close surveillance breast cancer screening in the contralateral opposite breast, including imaging with mammography and MRI. Mammography and MRI are not recommended to be done routinely in reconstructed breasts because most local recurrences of breast cancer in the residual tissue are palpable during clinical breast examination. That's a safety alert. Okay, safety alert. Adjuvant therapy. The decision to follow the original surgical procedure with additional treatment to help keep the cancer from recurring is known as adjuvant therapy. So they take the decision based on stage, pathologic examination, the HER2 status, presence of a known genetic predisposition. Adjuvant therapy for breast cancer consists of systemic chemotherapy, radiation, or a combination of both, as we explained before. Radiation therapy is administered after breast conserving surgery to kill breast cancer cells that may remain near the site of the original tumor. Partial breast irradiation is an option for women with early stage breast cancer. Usually, the surgery is the first step. If the tumor is too big, they are going to give chemotherapy first to shrink the tumor, then the surgery, then radiation. Brachytherapy is a form of treatment in which an external catheter is inserted at the lumpectomy cavity and surrounding margin, and radioactive seeds are inserted into a multicatheter or balloon catheter device. Radiation is given over a period of 5 years. 5 days, 5 days. 10 treatments are given in total with at least 6 hours between treatments. Intraoperative radiation therapy is the most accelerated form of PBI. It uses a high single dose of radiation delivered during the lumpectomy surgery. Nursing safety priority. Teach women undergoing brachytherapy for breast cancer that radiation is contained in a temporary catheter and then removed prior to going home. The risk for others to be exposed to radiation is very small. Body fluids and items contacted by patients with brachytherapy are not radioactive. And this is something that you need to teach and make sure they understand, because sometimes family members can be scared. Okay. However, during the time that radiation is delivered, the patient will be alone in the room. Yes. But after the catheter is removed, no problem. Chemotherapy is recommended for treatment of invasive breast cancer and surgery. Adjuvant chemotherapy is also be given before surgery to reduce the size of the tumor. We spoke about this. Repetition, repetition, repetition. Nursing safety priority. Teach patient undergoing chemotherapy with doxorubicin and trastuzumab to be aware of cardiotoxic effects, and that's good to know. That's good to know. Make sure you remember these medications, not only for the exam, but whenever you see somebody, any family member, any patient, any good friend that is having these chemotherapies, you want to teach them that cardiotoxicity is possible. Patients will have routine testing of their cardiac function and ejection fraction because this side effect is often asymptomatic. Is asymptomatic. Instruct them to report excessive fatigue, shortness of breath, chronic cough, and edema to the healthcare provider. The side effect can manifest years after treatment. So you finish your treatment in 2011, you can have this side effect in 2016. And let me ask you something. Shortness of breath, edema, okay, and swelling are the triad of congestive heart failure. So you have two out of three, shortness of breath and edema, okay? Congestive heart failure. Selective estrogen receptor modulator, which is your tamoxifen, on the other hand, do not affect ovarian function. Rather, they block the effect of estrogen in women who have estrogen receptor positive breast cancer. Aromatase inhibitors such as letrozole and anastrozole are used in postmenopausal women whose main source of estrogen is not the ovaries, but rather body fat. As I explained to you, postmenopausal women, they have estrogen coming from adipose tissue. Okay. Care coordination, home care management. These patients may need some assistance at home with drink care, dressings, ADL because of pain and impaired range of motion of the affected arm. See the home consideration box. Teach patient that activities involve stretching or reaching for heavy objects should be avoided temporarily. So you can have you see the box here with the hub considerations about assess cardiovascular, respiratory, and urinary status, vital signs, lung sounds, urine output. Okay. Why urine output, professor? Because you are checking for edema, swelling, fluid retention. So we need to check how the kidneys are working, how is the urinary status. Assess dressing and incision site for infection, blah, 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 blah. Read this. Although swelling and redness of the scar itself are normal for the first few weeks, swelling, redness, increased heat, and tenderness of the surrounding area indicate infection. We know this. If a lymph node dissection was performed, instruct the patient to elevate the effector arm on a pillow and to use interventions to decrease risk for lymphedema. Encourage the patient to dress in comfortable street clothes at home, not pajamas, to further enhance a positive self-image. Recovery from breast cancer surgery. Should empty the reservoir twice a day and record the measurements, the Jackson Prats, or maybe more, if, right? Drains are generally removed when drainage is less than 30 mL per day for 3 consecutive days. You can expect mild pain after surgery, but within 4 to 5 days, most patients have no need for pain medication or require medication only at bedtime. Here comes that's good to know. Numbness in the area of the surgery and along the inner side of the arm from the armpit to the elbow, occur in almost all patients owing to injury to the nerves. Patients have described sensations of heaviness, pain, tingling, burning, and pins and needles. This is neuropathic pain, and short-acting analgesics may be given. This sensation may change over the next several months, becoming less and less noticeable, and may resolve entirely by the end of the first year following surgery. So it's a long recovery. Assess for neuropathic pain. That's good to know. Active range of motion exercises should begin 1 week after surgery and should be continued after sutures and drains are removed. Emphasize that reaching and stretching exercises should continue only to the point of pain or pulling, never beyond that. Let's stop here. Let's take a break and we'll come back with the final part 4 of chapter 65.